I'm Ashley White. I'm a senior fellow in the Materials Research Program Manager at USGBC. I'm a materials scientist by training. I came to the green building world about 8 months ago when I joined the US Green Building Council. So as materials scientists, we don't often in our training learn things about materials and their health impacts. So honestly, one of my first exposures to this topic was when I joined the US Green Building Council. And in the last 8 months, I've learned a wealth of information around materials and health. And I'm actually hoping now to be able to bring that information back to the materials science community so that we can better train our materials scientists, as well as how to interface with architecture and industry, manufacturing. I think all of these fields need to have a closer conversation. So what I spoke about today was materials education and innovation. So I started off by explaining how material scientists view sustainability, and that essentially material scientists don't necessarily think about human health as a priority when they're designing a material or selecting a material to go in a product. And then I also talked about materials innovation. So I think a lot of people are at least hoping that we can make some important changes in the ingredients in our products very quickly, maybe within a couple of years. But honestly, the materials innovation timeline is often much longer. We might look as far out as 10 to 20 years to get a change in a product. So the talk I was giving today, I hoped would help inform our conversation about maybe what piece materials science needs to play in educating people about the health impacts of materials compared to where architecture needs to train its professionals about how to address these topics. So basically, whose educational territory should this be in? The scientists, or is it the architect's responsibility? So one of the comments that resonated with me the most was when Lance Hosey spoke from RTKL, and he talked about the concept of what are healthy materials, and essentially that when we talk about healthy materials, we don't mean materials that are actually improving our health. We more mean materials that are benign. And so there's this question of, are we looking for materials that are simply not harmful? Or are we looking for materials that could even potentially improve our health in their presence? I think one of the biggest challenges that we're facing right now is public awareness. I mean public in terms of the general public, the average lay person, but also in terms of awareness among all of the different fields that play into the topic of materials and health. So I just spoke last week at a conference of materials science educators, and when I brought up the topic of looking at the human health impacts of materials, honestly, most of them did not realize that that was a topic to prioritize, that might even be an issue. So even just talking to people, bringing up the fact that we should be thinking about the health impacts of materials, I think is one of the first things that we can do to overcome some of the barriers that we face right now. So when we talk about success for materials and health, I think we need to look at different time frames. So success in 5 years might simply be that a majority of manufacturers are willing to disclose their ingredients. One of the things I talked about today was the materials innovation timeline, and that honestly some of these broader changes in the industry could take 10 or even 20 years. So I don't think it's quite realistic to expect that we're going to have only healthy, non-toxic products on the market in 5 years, but perhaps 20 years, 30 years down the line, then that would be a realistic success for our field.